Hello everyone, my name is Sanchita Chetri and this video covers the fundamentals, evidence, a practical demo and a case study on therapeutic ultrasound in physiotherapy. In this video, we will look at the theory behind ultrasound, evidence from research, a lab demonstration, a clinical case and obviously a conclusion. So let's begin. Ultrasound transmits high frequency sound waves, often 1 MHz or 3 MHz via transducer. In the lab demonstration video, I will show what a transducer is. Continuing, the wave causes mechanical vibration in tissues which can produce both thermal and non-thermal effects. Thermal effects includes heating, increased blood flow, increased extensibility of collagen, and non-thermal effects includes acoustic streaming, microsteaming, cavitation, which may influence cell membrane and ion flow. So common indication of ultrasound. It means when to use the ultrasound therapy. It's during tendinopathy, bursitis, soft tissue injuries, scar tissues, and muscle spasm. And contraindications are as follows: acute inflammation or infection, malignancy in area over epiphyseal plate in children, over pacemaker, over eyes, and in pregnant women, etc. Now that we have basic understanding of what ultrasound therapy is, let's move on to the laboratory demonstration to see how it's practically applied. For that, I'm sharing my screen with you all here. In this video, I will demonstrate the application of ultrasound therapy on the arm region. The steps include checking contraindication, applying coupling gel, setting frequency and intensity, and performing the treatment in circular motion. After the introductory part, I switched on the ultrasound machine. Since the arm involves more superficial tissue, I'll select 3 MHz frequency. Since 1 MHz frequency is for deeper tissue, like in chronic back pain. I am setting the machine to pulsed mode as this is suitable for acute condition or inflammation. As I had mentioned earlier, pulsed mode is suitable only for acute condition or inflammation. This intensity is set around 0.8 watt per square centimeter and the timer is adjusted about 5 minutes. Before starting, I checked for any contraindication in my patient, such as open wounds, metal implants, or skin infection. My patient is seated comfortably with the area well supported and the treatment area exposed. I roughly cleaned the area. I am now applying a thin layer of ultrasound gel on the treatment area. The gel helps to transmit the ultrasound wave efficiently and prevents air gaps between the skin and the transducer. This is transducer. I am placing the transducer head gently on the gel. I am placing the transducer head gently on the gel and moving it in a circular motions over the affected area. It's important to keep the transducer moving continuously to prevent any tissues overheating. The patient may feel wild warmth, but there should not be any pain or discomfort. From time to time, I was making sure that my patient does not get or feel any discomfort or pain. After the timer ended, I pressed stop, cleaned the gel from patient's skin, and wiped the transducer. This treatment helps to improve blood flow, reduce pain, and enhance healing process. After understanding the practical demonstration of ultrasound therapy, it is also important to know how it differs from TENS therapy. Since both are electrotherapy techniques, both serves different purpose in physiotherapy treatment. Now let's understand the difference between TENS and ultrasound therapy, which are the two most commonly used electrotherapy modalities in physiotherapy. The image above, as you all can see, is TENS machine, and the image below is ultrasound therapy machine. So TENS. TENS stands for transcutaneous electrical nerve stimulation. It works by sending low frequency electrical impulse through through electrodes that are placed on the skin. This impulse stimulates the sensory nerve, which helps to block pain signals from reaching the brain. It also promotes the release of endorphin, which are body's natural painkiller. Patient usually feels a mild tingling or buzzing sensation during the treatment. TENS is mainly used for pain relief, especially in conditions like chronic back pain, arthritis, or post-surgical pain. However, it should not be used over open wounds in people like pacemakers or with pregnant women's abdomen. Now comes the ultrasound therapy. Ultrasound therapy uses high frequency sound waves, usually 1 or 3 megahertz, which travel deep into the tissue. The sound waves produce microscopic vibrations and deep heating, which helps to increase blood circulation, reduce inflammation, and promote tissue healing. It's commonly used to treat muscle strains, ligament injuries, tendinitis, and scar tissue. During the treatment, the patient may feel a gentle warmth or sometimes no sensation at all, depending on whether it's continuous or pulsed mode. As you all know, why is pulsed mode used in the earlier demonstration video I mentioned. That was the practical part of the procedure. However, physiotherapy is an evidence-based profession, so it's important to understand what effectiveness of research says about this treatment. So again, I will be sharing my screen. This is the article I'm using for my evidence section. The title is clearly mentioned here. Effectiveness of ultrasound therapy management of non-specific chronic low back pain. A systematic review. It was authored by Ibadi and colleagues and published in 2021. I'll now highlight a key conclusion from this paper. Here, I would like to highlight this important conclusion from the paper. It clearly states that therapeutic ultrasound does play a role in reducing pain intensity in patients with non-specific chronic low back pain. However, it also emphasizes that we need to reconsider both benefits and potential risk of long-term use and not rely on it blindly as a routine protocol. The author also points out that more high quality, large scale clinical trials are needed to truly establish its effectiveness, especially when used alone. This means that while ultrasound can be helpful adjacent treatment, we still need stronger evidence before calling it a gold standard for chronic low back pain management. Now that we have reviewed the research evidence, let's connect it with theoretical foundation described in standard physiotherapy textbook. For that, I'm sharing my screen again. The name of this book is Electrotherapy, edited by Sheila Kitchen, and a topic within this book which I've selected is ultrasound. This section of the book is titled Physical Effects of Ultrasound. It explains what actually happens inside our body tissue when ultrasound energy is applied during physiotherapy treatment. When ultrasound waves enter the body, they affect the cells and tissue through two main physical mechanisms: thermal effects and non thermal effects. Thermal effects. Thermal effects occur when continuous ultrasound is applied at a sufficient intensity. This increases the temperature of tissue underneath the skin. As the temperature rises, it leads to increased blood flow, reduce in muscle spasm, and a greater tissue extensibility, which means the soft tissues like muscles, tendons, and ligaments become more flexible. This effect is especially useful in chronic conditions, for example, to prepare tissue before stretching or mobilization, or to relieve pain and stiffness. Non-thermal effects. Non-thermal effects happen even when the tissue temperature does not rise significantly. For example, during pulsed ultrasound, this effect includes acoustic streaming and stable cavitation, which are basically gentle movements at cellular level. They help to improve cell membrane permeability, stimulate tissue repair, and promote wound healing. These non-thermal effects especially are helpful in early stages of injury when we want to promote healing without adding heat. So why understanding this matters, you may be wondering. This book also emphasizes why it's important for physiotherapists to fully understand this mechanism. Some effects are beneficial, such as stimulating wound healing and tissue recovery, but others can be potentially dangerous if not used properly. For example, overheating tissues or causing unwanted cellular changes. That's why proper dosage, mode selection, treatment type, and treatment time and patient safety are crucial. So, to summarize, the physical effects of ultrasound are the foundation for its clinical application. If we understand how ultrasound behaves inside the body, we can use it more effectively for conditions like soft tissues, injuries, muscle tightness, tendinopathies, and wound healing. At the same time, knowing the risk helps us avoid complications and ensure safety practices. This theoretical understanding links directly to research paper and lab demonstration part of my presentation. Once we know how ultrasound physically works, it becomes easier to understand why it helps certain conditions and how it should be applied correctly. After understanding both evidence and theoretical basis, let's look at clinical application through a case study video. So physiotherapy with ultrasound after limb lengthening. This case study shows a physiotherapy session after a limb lengthening procedure. The goal is to reduce pain, stiffness, and swelling using ultrasound therapy. Ultrasound waves are applied to muscle around the lengthened limb. This helps to increase blood flow and speeds up tissue healing. During each session, the therapist moves the ultrasound head in circular motion to cover the treatment area and evenly and avoid hot spots. I'm again going to share so that you can see how the physiotherapist applied in the ultrasound head in circular motion. So So, regular sessions like this support the recovery and improve flexibility and helps consistent patients regain comfort and confidence after surgery. So through this video, we covered the introduction, practical demonstration, supporting research, theoretical concept, and clinical application of ultrasound therapy. To conclude, therapeutic ultrasound is one of the most valuable electrotherapy modalities in physiotherapy practice. It works by using high frequency sound waves that penetrates tissue, producing both thermal and non-thermal effects. These effects promote tissue healing, increase blood circulation, reduce pain, and improve mobility. In the laboratory demonstration, we saw how ultrasound is safely and effectively applied, starting from checking contraindication, applying coupling gel, setting the correct frequency and intensity, and maintaining continuous movement of the transducer to prevent tissue damage. This practical understanding helps us to connect the theory to real life application. From the research perspective, several studies have confirmed that effectiveness of ultrasound therapy is managing in musculoskeletal conditions such as tendonitis, muscle strain, and joint pain. This research finding highlights that ultrasound, when applied with correct parameters and dosage, can accelerate recovery and improve functional outcome for patients. So, according to the book chapter reference, for example, Electrotherapy, edited by Sheila Kitchen, ultrasound therapy produces both mechanical and physiological effects that aid in tissue repair. The theoretical framework supports what we observe clinically and prove a solid scientific foundation for its use. Finally, in the case study, we saw how this principle and research finding comes together in real clinical practices. A patient showed significant pain reduction and functional improvement after consistent ultrasound sessions. This is the line we often hear. This emphasizes that physiotherapy is not only about knowing techniques but about applying them based on evidence, safety, and patient centered care. Overall, through this presentation, we moved from understanding the basic concept of ultrasound and seeing its practical demonstration, exploring support research, relating it to textbook knowledge, and applying it to a real case. This shows the complete journey of how physiotherapy integrates theory, research, and clinical practices to promote healing and improve the quality of life. So, everyone, if any one of you hear that physiotherapy is all about massage, I hope you can share my video to them and tell them that physiotherapy is more than what you think. Thank you.